Hi, and thank you for joining our educational webinar with Dr. Ryan Nord on how inspired therapy can assist with sleep apnea. My name is Sharnice Smith, and I am a member of VCU Health's marketing team. Before we begin the presentation, I'd like to first make note that we will hold all questions until the end. So please feel free to drop any questions in the comments area, and we will address them at the end. And now I'll be introducing Dr. Nord. He is a director of sleep surgery in VCU Health's Department of Otolaryngology. He focuses on reversing the causes of disordered sleep, starting with medication and specialized surgery, including Inspire upper airway stimulation therapy. Thank you, Dr. Nord, for joining us today. And I will now turn the show over to you.
Thank you so much, Sharnice. So I do hope to give you an overview today about sleep apnea, tell you a little bit about what it is, remind you and review some of the typical treatments for sleep apnea, and then get to Inspire and hopefully highlight why it's different and why I think it's an exciting treatment. So I'm at VCU, as Sharnice mentioned, and I'm at a number of different clinic locations. So hopefully, if you are a patient looking to come in and get your sleep apnea treated, we can find a convenient place for you. So I'm downtown at Nelson, also at Stony Point, and I have locations south of Richmond as well. And I also work at the VA Medical Center. So sleep apnea is a condition where the upper airway collapses repetitively during sleep. And this is often marked by snoring. And when the oxygen levels decrease, that's sensed in the brain, and it actually wakes your body up, which, as you can imagine, leads to sleep that's not very restorative and restful. And so this process repeats many times throughout the night, with people stopping breathing 20, 30, 40 or more times every hour. Some of the symptoms of sleep apnea include snoring, breathing pauses during sleep, being really sleepy, or even if you sleep a full night's sleep, waking up feeling like you're just still tired and not refreshed. Poor concentration, and oftentimes you might notice having a headache in the morning as well. So if any of these symptoms sound familiar to you or to any of your loved ones, that would definitely be a good indication that you may want to talk to your physician and consider getting worked up and to see if you do have sleep apnea. In order to really know for sure, you need a sleep study, and this is a drawing or kind of a figure of what a typical sleep test would be. Thankfully, it's become a little bit more convenient and simplified recently, and you don't necessarily have to spend all night in a hotel or in a hospital to get an accurate test now. You can actually take a pretty small device home and with just a few sensors, wear it at night and have a good understanding of whether or not you do have sleep apnea. And we can also tell how severe it is, and that is important when we're talking about treatment, because depending on how bad it is, there may be different types of treatment. Of course, sleep apnea is not just about the inconvenience of snoring. It actually has a number of pretty significant health consequences if it's untreated. So we know that for someone who has sleep apnea and doesn't pursue treatment, oftentimes because they may not even know they have it, they're at a 3 to 4 times higher risk of suffering from a stroke, a heart attack, and even dying for any reason. And so it's really critical that we identify people who have sleep apnea and get them the treatment they need. Beyond those health consequences, there are some that are you may not think about as much, but actually can be caused and worsened by sleep apnea. Depression, changes in cognitive function or memory, and it even worsens diabetes. Sleep apnea is more common than you think. It actually affects 7 to 10% of the adult US population. And so that's actually as common as diabetes. And sleep apnea is associated with obesity. And so many of our patients are obese, but you can actually be thin and also have sleep apnea. Of course, as the population becomes more obese, as we'll see in this next slide, we certainly think the prevalence of sleep apnea is going to worsen. So as you can see in this slide from the CDC, this is showing the percentage of people with obesity as time goes on. And as the colors change, as you can see along the bottom, the percentage goes up and up and up. And so we're at a point now, as you can see on the next slide, with the most recent data, where 30 to 35% of people in our own state of Virginia are clinically obese, and of course with that are going to have a very high risk of having obstructive sleep apnea. There's a lot of different treatment options, and I'm not going to be able to go through them all in detail, but I do want to touch on them just so you have an idea of the context of the options and kind of what's out there. So the first line treatment is CPAP, which you see in the upper left, and this is a mask that you wear over your face or over your nose, and it blows pressure in and basically opens up the airway by just stenting it open with air pressure. This is the first line treatment because of the fact that it's safe, effective, and affordable. And so we really, almost without exception, always try CPAP before anything else. An oral appliance, which you can see an example of in the top right, is made by dentists, and there's a number of dentists who are especially trained to do this. And it's an upper and a lower mouth guard, and it works by pulling your lower jaw forward. And as the jaw is pulled forward slightly, that also pulls the tongue forward, and it opens up the airway and makes it less likely to collapse. This can be really effective for people, especially people with more mild to moderate sleep apnea, but also in some cases, in more severe cases as well. And so it is an important treatment option to consider. Moving on, there's various types of surgery, which I will discuss in detail in the next slides, but it either involves rearranging tissue in the airway or stimulating nerves to open up the airway. So again, CPAP is the gold standard. We know that it works well, and there's many studies to show that. It's very cost effective, and really there's not much risks to it. I think the question really is that although it is effective and it works, it's not very well tolerated by many patients. So somewhere between 40 to 60% of patients cannot tolerate CPAP. And as we talked about, given how incredibly prevalent sleep apnea is, this leaves many millions of people potentially without treatment that they need to potentially save their life in order to not suffer the consequences from sleep apnea. So what do we do if CPAP fails? As an ear, nose, and throat doctor, I typically start with looking in their mouth and seeing if I can start to understand why they might have this issue in the first place. As we stated in the beginning, sleep apnea is a disorder where the airway collapses at night. And so a lot of times if I'm able to look into their airway, either when they're awake or when they're sleeping, I'll get a much better idea of where the problem is. And once I know where the problem is, I have a better idea about how to treat it. One of the new ways that we have to understand this question of where the blockage is happening in the airway is called a DICE procedure, or a drug-induced sleep endoscopy. And this is an example of one of our residents performing this procedure under my supervision. And you can see the patient comes into the operating room, they're given an IV sedation, And then we're able to use a small camera to look from their nose down into their throat while they're sleeping and snoring, so that I can see exactly where the blockage is and tailor a particular treatment to that individual. And so if you can play this video is an example of several different endoscopy procedures. And what I will try to talk you through what we're seeing here, but this first video, we're looking from the nose down into the throat, and we see the back of the tongue here, and then you can see a structure that's shaped a little bit like a V, and that's the epiglottis. And hopefully you can get a little bit of an idea of seeing that epiglottis actually fold in on itself. And this is another example now looking at the soft palate. The soft palate is very commonly involved in the collapse of the airway in sleep apnea. And that's the soft part of the roof of your mouth behind the hard palate. And the uvula hangs off of this. And so that is often involved in sleep apnea and causes a lot of the sound that you hear when you hear snoring. And as we continue to look at different types of collapse patterns, again, we're looking at the soft palate here, which is totally sealed up in this video. And we see the tongue now, and the tongue is not leaving much space for the rest of the airway. And so there's multiple issues with this patient, as is the case with many patients. It may not be just one level. There can often be multiple different things that are going on. And I think this is the last video. And what you're going to see here is a younger, healthy woman. And those structures that you're looking at that are touching each other are the tonsils. And so in this lady who was in her 30s, she underwent a tonsillectomy, and that alone was effective for treating her sleep apnea. So hopefully that gives you a brief glimpse into the fact that sleep apnea is not the same for every patient. Each patient has a little bit different reason why their airway might collapse. And typically it's not just one area, typically it's multiple areas. And the reason that's important is because we then need to treat more than one area. If we do a treatment of just one section, for instance, the soft palate or the tongue, then we're likely to not have very good results because we're leaving out the other levels. So there's a lot of medical terms here, but I just want to show you that there's a lot of different surgeries that we can do depending on the area of the airway that is actually collapsed. Whether it's a nasal surgery, whether it's a surgery on the soft palate, the tongue base, or even lower down in the airway, we have numerous different options in our toolbox to treat every level of obstruction. Patients often ask me about their nasal obstruction, and it's often thought that because they can't breathe through their nose, that's really the reason that they have sleep apnea and the reason that they're snoring. And so they may think that it's as simple as just opening up the nose and relieving that obstruction, and then things will be much better. And unfortunately, that's not exactly true. It is very important that you're able to breathe through your nose, especially at night, because mouth breathing does make it more likely that you're going to have sleep apnea and have blockage of the airway. But what we know is that fixing your nose, although it's useful and it's worthwhile to do and beneficial, unfortunately, most times it doesn't fix the sleep apnea, because remember, that's an issue that happens in your throat, not in your nose. There's a surgery called a UPPP, and that's been around for many years. Probably if you know anybody who's had surgery for their snoring or sleep apnea some years ago, this is probably the surgery they had done. It was invented in the 1980s and was very common over the next couple of decades. And what it was a removing the tonsils and then removing part of the soft palate and sewing things together. As you can imagine, this is an incredibly painful procedure, and there are a number of complications that can happen from this, such as issues with swallowing, where food and liquid could be regurgitated through the nose with eating, and again, a lot of pain and not a fantastic success rate, only about a 50% success rate. And the reason for that, again, is that this really just treats that one level of obstruction. And we know that most people have multiple levels of obstruction. So again, a large kind of name for this procedure, but this is kind of how some of this surgery has evolved over time. Now, instead of removing tissue, we're able to rearrange it. So we are able to cut some of the muscles of the throat and sew them in a direction that pulls the airway open in a side-to-side direction and also pulls the soft palate forward. If you can see in this next slide, an example of one of my patients who underwent this procedure. And on the left side, this is a patient who's already had their tonsils removed. And you can see a very narrow airway of just 1.5 centimeters or less than an inch. And then after this rearranging was done, the airway is about twice as large as it was before. And so this definitely can be an effective surgery. As you can imagine, it's really very painful, still a painful surgery, really a 2-week recovery of not being able to work and oftentimes needing some strong pain medication. There's also a procedure called hyoid suspension, and there's a brand name called the airlift procedure, if you've heard of that. And this is a little bit less invasive procedure where we can put sutures around the hyoid bone, which is the bone under the chin. And that is important because your tongue and also your epiglottis are attached to this bone. And in certain people, the bone is misplaced and it's too far down and back. And that's one of the reasons that an individual might have sleep apnea. So we're able to reverse that in some patients by putting a suture around that bone and pulling it forward and up. And that results in an enlarged airway in the lower down portion of the airway. As you can see in these two pictures, the one on the left is a very constricted or small airway. There's really no space. And then after this airlift or hyoid procedure, you can see a larger space. So that may be an effective procedure, but again, it is really a one-level procedure, and so it either has to be selected very carefully or combined with other procedures. So now I want to get into hypoglossal nerve stimulation. This is an FDA-approved treatment that has been approved since 2014 to treat obstructive sleep apnea. You can see the size of the device. It's similar to a pacemaker in that it is under the skin and it is able to monitor your breathing and stimulate the muscles in your airway so that they open up and don't collapse at night. So here's a schematic of what the Inspire procedure, the device, looks like. As you can see, it's a 3-part system. And so it is put in through 3 incisions on the right side of the body. One is under the chin, one is under the collarbone, and one is between the ribs. The main part of the surgery happens under the chin, and that's where I find certain nerve branches that control your tongue. And we're able to actually test each little branch of the nerve that controls your tongue to find the branches that make the tongue stiffer and pull it forward. And those are 2 actions that we want to stimulate during sleep so that the tongue is pulled forward and the throat and the airway remains open during sleep. There's then the generator or the battery that goes under the collarbone, and that is under the skin. Typically, you would not see it, but you can feel it under the skin. It's a battery that lasts for about 10 years, and it does not have to be recharged. And finally, there's a breathing sensor that's placed between the ribs, and that is able to sense the pressure in the lung and monitor the breathing, so that as you go to sleep, you turn it on with the remote, which is seen in the right picture. And after a set time period, depending on how long it takes you to fall asleep, the device turns on, and then it's able to sense each breath and provide gentle stimulation to the nerve, pulling the tongue forward and opening the airway so that the patient doesn't stop breathing. And these are just different videos, which are basically, again, showing that this is a multi-level procedure. So it does work by pulling the tongue forward and opening up the airway at the base of the tongue, but it also, thankfully, works at different levels, such as at the soft palate, which is a very common area of obstruction in sleep apnea. And so it works at multiple levels, which is one of the main reasons it's such a successful treatment. In order to be a candidate for this procedure, you have to have at least moderate to severe sleep apnea, and it has to be the obstructive type. Although I won't get into it now, there is a type of sleep apnea called central sleep apnea, which is much less common, but is not well treated by this device. You have to have tried CPAP, and that's important. We don't skip over CPAP, and we don't do this surgery for people who are using CPAP and benefiting from it. It's never a surgery of convenience. We want to do the surgery for people who really need it and are not able to use or benefit from CPAP. And oftentimes they either remove the CPAP at night and aren't aware of it, or maybe suffer from significant claustrophobia. There is a weight limit that's important to know for this surgery for Inspire. It depends on the insurance company, but typically we will say that the body mass index, or the BMI, needs to be under 35. And if you don't know, BMI is basically a measure of your weight relative to your height. And it's easy to find that if you put it into the, if you Google BMI, you'll be able to enter your height and weight and find what your number is. Sometimes patients do come to me at a level higher than 35, and oftentimes I work with some of my colleagues in the weight loss program, and we're able to get the weight into a better range. It's FDA approved for adults aged 18 plus, and you do have to pass an airway exam, which is what I showed you earlier in the talk, called the drug-induced sleep endoscopy. We need to find a certain pattern of collapse to determine if the Inspire device would work for you. Thankfully, about 90% of people do pass that airway exam, and if for those patients that don't, we're able to offer other treatments as a first step. The Inspire procedure results in a significant reduction in the amount of events that patients suffer from. So on average, in a very large study, they found that most patients start in the close to severe range, with stopping breathing close to 30 times an hour, which would be once every 2 minutes. And then afterwards, with Inspire, down to about 6 times an hour. Keep in mind, anything under 5 is considered normal. So certainly getting into that range is something we hope to aim for in our patients. Many of my patients are really worried about snoring, and the Inspire device definitely addresses that. The vast majority of patients will have significant improvement in their snoring. In fact, many of our patients, the snoring is so severe that they're unable to share a bed with their bed partner. For instance, in this study, 30% of people were unable to have a bed partner sleep in the same room due to how loud and disruptive the snoring was. After Inspire, that's down to 1%. And this is just a graph showing that this is not a procedure that only works over the short term. We've now monitored a lot of these patients over 5 years and found that it's just as effective at 5 years as it was immediately after the surgery. And I do think that's one of the things that definitely sets it apart. And because it doesn't depend on a suture staying tight. It's something that we can change how strong even the stimulation is over time. So if someone's sleep apnea gets worse, we're able to adjust with that and change over time. And so these are just some of my own results from our patients at VCU. Again, patients starting out in the severe range and getting down into the mild range on average. And so I generally quote people that we hope to reduce the amount or the severity of their sleep apnea by about 80%. Thankfully, it's covered by insurance, including Medicare, including over 250 different insurance companies. It is a case-by-case basis for certain insurance companies, but thankfully we're able to handle the insurance issues so it's not a burden on the patient, and we never proceed with any of this surgery unless it's approved by the insurance company first. In terms of what to expect, the surgery is a general anesthesia. You would go completely asleep. The surgery takes about 2 hours. You go home the same day. Typically, there's just some mild soreness and swelling around the incisions, and patients are generally up and doing their regular activities within a few days. We take a look at the wound about a week later just to make sure everything's healing well, and then the device is activated 1 month later. Finally, we do a sleep study to check our work and do any fine-tuning to make sure we have good results, and that's typically done 2 to 3 months after surgery. So in conclusion, sleep apnea is a diverse disease that is caused by really different reasons in different people. And so we need to understand, and thankfully now we can understand, what the problem is in each specific patient, and we can target the right treatment to those issues. And hypoglossal nerve stimulation, or Inspire, is really one of the most effective and least invasive options for treating sleep apnea. And so we're happy to be able to offer this treatment at VCU. And I welcome your questions about anything that we've discussed here today. Please do just type those in the comments and we will get to them. This is how you would schedule an appointment. You have a telephone number here and, of course, my various clinic locations. Thank you. And that's my son, JP, and my daughter, Charlotte.
Thank you, Dr. Nord, for that informational presentation. I learned a lot about sleep apnea, and the Inspire therapy system, I think, is definitely a great option for people with sleep apnea. So as Dr. Nord said, we're opening the floor for any questions. We'll first read some questions that were sent in advance, and then we'll move on to questions that are added in the comment section. So the first question that we have is, does drinking alcohol influence snoring or sleep apnea?
Great question, and the answer is yes. And probably the person who typed this is probably aware of it, because I know I hear from a lot of my patients that their snoring gets a lot worse when they have a few drinks of alcohol. And alcohol is a depressant, and it is a central nervous system depressant. And so with that, it does significantly increase the severity of the snoring. And so the amount of times that someone stops breathing is going to go up typically. And even people who don't have sleep apnea can develop it, after a night of drinking.
And this is a two-part question for that, a question I have. So can you drink alcohol with the Inspire system?
Yes, you can. There's no restrictions in terms of your your diet or anything like that. Some of my patients may even increase the level of stimulation a little bit if they know that they are going to have a few drinks. And that's one of the nice things in terms of the flexibility of this system. But it's just good to be aware that drinking is going to make it worse.
It's good to know. Our next question is, does the Inspire therapy procedure produce a noticeable scar?
So any surgery that requires making an incision will heal in a scar. Thankfully, these scars tend to fade to just a white line that is typically not very noticeable. But yes, there will be a scar.
Okay. And the next question, how often will you need to have your Inspire system checked?
Yeah, that's a good question. So as I mentioned, the device is turned on about 1 month after surgery. And during that initial time, there are fairly regular follow-ups, perhaps every month or so for a few months, to make sure that all your questions would be getting answered and that any fine-tuning that's needs to be done is done in a timely fashion. So initially there's fairly regular follow-up, and then typically after a few months when the effective range has been reached and we have a sleep study showing good results, we transition to more of a yearly follow-up schedule.
Okay, it's great to know. Our next question is, what patient training is needed to adapt to using Inspire post-op?
Yeah, during that appointment when we turn on Inspire a month after surgery, that's typically about an hour-long appointment where we go through everything in detail about how to use it, turning it on, pausing it, how should you increase the level of stimulation, when should you decrease the level of stimulation. And so it's definitely a learning curve, but we provide a lot of support. There's also numbers through Inspire that's actually open 24/7, and a patient can always call with any questions if they forget how to turn something on or pause it, and we can, there's a lot of support that's available for that.
Oh, that's awesome. And then do patients go home post-op and use their CPAP that night? Or what is the procedure?
So patients go home that day. They typically do not use their CPAP, and the reason I say that is that most of my patients, again, are not able to tolerate CPAP. Now, if they are a patient who falls into the category where they are able to use it for a few hours a night, and I definitely encourage that. We always want to treat the sleep apnea as much as we can, and so during that time before the device is turned on, some of my patients will use it for a few hours a night if they can do that.
Okay. And then another question, I see you are an Inspire Center of Excellence. What does that mean?
So yeah, there's about 400 or so centers around the United States that perform this procedure, and VCU has been, I think, lucky enough to be recognized as a center of excellence, and I believe we're one of 12 or 15 in the country, and that really just signifies the fact that we have really good results, and we really focus in on this, and also we have a great team. And so I'm one part of that team, but we also have the sleep medicine department and really a lot of other faculty and staff that make sure that all of our patients are getting everything they need.
It's awesome. Well, that's all the questions that we have. Thank you again, Dr. Nord. It was such a pleasure having you join us for this educational webinar, and I'm glad that we were able to learn more about sleep apnea, but also how Inspire therapy can help with sleep apnea and sleeping better. So to learn more about Dr. Nord and the VCU Health Sleep Medicine, please visit vcuhealth.org. And once again, thank you, Dr. Nord, and to all who joined today, have a great night.
Thank you, Sharnice, and thank you for everyone who tuned in today. Hopefully I'll see you soon.
Bye, everyone.